coronavirus has changed all of our lives, but how will it impact our future? Does this change everything? I am Alar Tankler. On this episode of Does This Change Everything? The topic is financing the preparedness against infectious diseases. This might sound obvious, but the question is, how, if at all, were we preparing for possible pandemics in the past? And how will the current coronavirus change this? And we're going to ask this from Shiva Dustdar, who's the head of the Innovation Finance Advisor Division at the European Investment Bank. And she was at the birth of a financial instrument called the INNOFIN Infectious Diseases Financing Facility several years ago. So, Shiva, do you think the coronavirus will change things in the area of preparing for pandemics?
Thank you, Alar. Indeed, I hope that I'm talking on behalf of many who feel that at hindsight, the world just did not wake up to the alarm bells in the prior SARS, pandemics. And hence, yes, I do really hope that this is, this time around, because of the global devastating impact, we are going to have, in fact, a paradigm shift or a really global mindset change. I know these sound very cliches, but I really do see that this is the only way for us to really ensure that we are now better prepared. You may have heard of the expression of the Black Swan, which came sort of about during the last financial crisis, this tail end risks, these very unlikely events of like a black swan. Swans are white, and here you have a black swan. So nobody thinks that there is one until you actually see one, and then you become more conscious of the likelihood of one. And that then, in a way, gets reflected in your future risk assessment frameworks. And on the one hand, you understand that you had therefore completely underestimated a certain risk. And on the other hand, now understanding it gives you at least the understanding to see how you can mitigate it, how you can therefore become better prepared.
But Shiva, let me just interrupt you for a second. Do you think, so my understanding is that the risk is typically assessed by, the likelihood of an event happening times the damage that could do. Which one do you think is changing because of the pandemic? Do you think that people are more conscious of the possibility of another pandemic sweeping the globe? Or will there be a better understanding about the enormous impacts that will bring about?
I think this is an excellent question, and I would suggest both. And I really now think back of sort of the discussions of pandemics and global health more broadly so far. So in terms of the risks, the probabilities that you're referring, I think we have looked at it with a rather limited lens, a narrow lens. You may have heard the expression of neglected diseases, the disease of the poor. So here, very often when people talked about infectious diseases, we sort of looked at it at diseases like tuberculosis, malaria, HIV, mainly affecting, developing countries. And as bad as this may sound, but somehow, we just did not necessarily see how this could become something that actually would affect the globe, everyone. I mean, that, even though the science tells us that viruses do not know borders, do not respect any of the boundaries that we are setting, GDP or race or nationality or anything, somehow we underestimated the risks. Yeah. But as you also point out, clearly we also absolutely estimated the economic damage. So if you think of the cost-benefit analysis that drove decisions in the past of, should countries, companies invest in, global health, R&D, infectious diseases. So on the one hand, you would sort of look at a few billions, let's say $1 billion euro dollar per vaccine. And this would be over 10, 15 years. It seemed always a lot of money for a potential, and on the cost side, nobody really understood how to capture it. And because a lot of it was about developing countries that perhaps didn't have, you didn't have a good understanding of how their GDP may be affected, there was a complete underestimation. So right now you're looking at it, of course, if you look at all the stimulus packages all over the world, we're talking of tens of trillions, so this would be what is the cost of not having done anything compared what prevention would have cost. We're talking maybe in tens of billions if you look at a portfolio of vaccines, of R&D activities, of some healthcare preparedness as a preventive tool. I mean, it is staggering, as you can imagine, and no rational decision maker would basically not invest in prevention, knowing the cost that would come by inaction. So therefore, I think it is both. It is really my hope is that we will, when we look at these risk assessment frameworks, we will look at both. And unfortunately, we now have the data, I guess, to understand it better. It's no longer, assumptions and worst case scenarios. Unfortunately, we're now living these really bad scenarios.
So in the past, the decision makers, they were putting the cost of preparing for pandemics, like the cost of investing into the development of vaccines, those billions against a possible upside or a benefit of a figure that they couldn't really put a good price on, but it was mostly calculated based on what a specific disease could do in the developing countries. And now, based on the experience we have now from the coronavirus, the hope is that we can put this investment into the preparedness, into the vaccines, against avoiding the damage of trillions that we are seeing that an actual pandemic can cause. Is that the gist of it?
Yes, I would say that is the gist of it. Again, we are generalizing, and I don't wish to suggest that there were no public sector, experts looking at it a bit more broadly. But as a general rule, I think one of the reasons of this chronic underinvestment in our preparedness has been indeed, on the one hand, basically underestimating the risk. So therefore, this tail end risk, these things, thinking that they just, are so unlikely to happen. It's like meteorites, hitting us. I mean, people just think this is so unlikely until one, of course, hits us. Then it becomes, it's likely. So there is a bit that. And then, of course, there's also perhaps a timing mismatch. So our political systems and the political decision makers, of course, they go through cycles of 4 or 5 years and re-election and all of that. And you have R&D, research and development, especially of vaccines in normal cases, taking 10 to 15 years. If you think of HIV, we're still working on developing these vaccines and constantly needing to update and improve these vaccines. So there is a mismatch, and hence very often we see that our maybe political leaders do not have the incentives to invest heavily in prevention because, they may not be the ones who get rewarded when then something down the line happens, which is rather unlikely and hard to understand. So there is really also, therefore, in this mindset change that I hope to see in the future is we really need to rethink, a bit our perhaps capitalistic models of returns on investments in a very different way. Now that we will have the data of the economic costs of not investing in prevention.
That's a great point, Shiva. Now, when you mentioned you had two other points that you think are going to change, what are those?
Yes, so the other 2 points, I mean, second point is hopefully a more positive note, because we have the science and the technology, the collective or the ability to really invest in the tools that would improve our preparedness. Now, what do I mean with that? Well, it is really, I think what will change, I hope, is with that new mindset of the importance of this preparedness, we will look at our innovation sort of at our R&D and innovation landscape in a much more interdisciplinary approach, in a way like preparing for war, where you look at all the science and technology that you have in order to prepare for it. So what do I mean with it? We have space technologies, we have of course the whole medical sciences. What we need is basically a much more integrated approach in investing in these, with a view to using all of these bodies of knowledge towards that greater preparedness.
Can
So
you,
it's not.
sorry,
Yeah.
can you just give an example, like how, for example, could space technology come in hand?
Well, space technologies can actually be extremely useful, as like think of satellites that can, trace, that can sort of track hotspots of, for instance, of epidemics. It's a matter of, making sure that we use the observation tools that we have, especially the satellites, to have a much better global perspective of how maybe epidemics could spread, how populations are moving. There are a lot of right now we're using these also for climate. So that's just one example. I think in the field of R&D in biology, a lot of the research and development in other fields that have progressed can actually now be very useful for also the science of vaccination and virology and so on. So, digitalization, I think of, our digital tools, our phones that we carry with us, can actually give our authorities also better sense of, they can communicate with us, and our devices also can communicate back. Now, so there is obviously a lot of, we have the tools. It's perhaps a matter of looking at them from that mindset of how can they contribute to greater preparedness.
Okay. And the third one, the third point you had that was about to change.
Yes, the third point is perhaps really another very important one that I think we should really now become more conscious of, is the role of the public sector. Right now, we see sort of the public sector very often in many economies, liberal economies, as sort of coming in right now to fix the problem. We sort of, and I hope with this we realize, I mean, the whole point of preparedness means that you prepare in good times. And that means that I think we all, as civil society, should rethink the role of public governments as being empowered to actually really invest in the healthcare sectors, invest in people's education, in digital platforms, and making sure that in good times as in bad times, the public sector is well set up and empowered to actually make and create markets and be very proactive and empowered, and not just coming in to fix an issue when everything else fails, when the markets collapse. Now, this is an area which many may have sort of heard and read. Mariana Mazzucato, she's a professor at UCL, who has written quite a lot about it, and in her more recent article in The Guardian on the 18th of March, she has actually made that point quite clear. I think this is an area where we all need to perhaps revisit our own thinking of the role of the public sector. And indeed, this may also then bring into it the role of institutions like the EIB.
And speaking of the EIB, so can you just very briefly, to finish things up, give an overview, what has been the EIB's role in this in the past, and what you hope for that to be moving forward?
Yes, so EIB has actually also, in a way, has had the tools and has invested in these areas, but perhaps more as a niche than as a matter of really large scale. So what do we have? On the one hand, we set up the Infectious Diseases Finance Facility back in 2015 under the Innofin program. This was actually a very important initiative. We, got the green light during the Ebola outbreak, but it was based on a lot of market assessment and consultation with important players like the Gates Foundation and other large foundations and member states to see how we can add to the mix of funding via grants, also instruments that have a repayable feature, where in a case of a success, you get actually repayments, and you actually manage to, do more with less, so to speak. So this was the Infectious Disease Finance Facility, which actually is now a very useful tool that the bank has. And as you may know, we're looking to finance a number of corona vaccine projects. And my hope is that with this new mindset change, instruments like that one, not only will they stay on in the new framework program, but perhaps we really need to look at ways to give them more resources so that they can actually do much more than they currently have. We also, as a bank, as you may know, have invested in healthcare systems in Europe, but also outside. But again, my sense is with the new mindset change, we should perhaps look at these investments together with the public sector, really with a view towards this preparedness for pandemics, and hence I hope that there will be many more investment opportunities for the EIB into this area.
Well, thank you very much. This was Shiva Dustdar, head of the Innovation Finance Advisory Division at the European Investment Bank. And this was Does This Change Everything? From the European Investment Bank, the EU Bank.